Hey, Kat, we're ready. I'm going to call this meeting to order of the Board of Health. Ladies and gentlemen, in the audience, Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America, republic, liberty, for all.
Shall we start, or someone want to call the Kat? Tell them we just did the Pledge Allegiance.
Some
273-5922.
This is director.
Oh. Okay. Okay, thank you. So she heard us. They haven't have technical difficulty. They're recording us, so we can go.
Oh, great.
Okay, very good. Approval of minutes, January 28th and February 11th, both 2020. We are going to postpone them because we don't have quorum to approve them at this time. Do I need a motion to postpone both of those?
No, that's chair privilege.
Things, Bridge?
I do think it's chair
Well,
privilege.
why don't you give me a motion?
All right, Mr. Chair, because we do not have sufficient members to satisfy quorums for January 28th or the February 11th, 2020 minute approvals, I'd like make a motion to postpone until we have a appropriate complement of board members.
Have a second? Favor?
Aye.
Aye.
3-0. Citizens' time, I don't think that we have any citizens who'll be coming before us this evening, because there are no citizens in the audience, or anybody for that matter. Chairman's report. I do have a couple of things. The first is I want to thank Dr. Saltzman, thank staff for a subcommittee we had with the school system.
That was
It's Friday.
Very good.
I know that was very good, and great cooperation. We're going to be working together, but thank you on your days off. Well, please for Dr. Saltzman to come in and spend some time, and thank you for the staff for being so ready. I really appreciate it very much. In addition, this coming Friday at 10:30, we have a subcommittee meeting with Ways and Means. That's the 28th, and also on March 4th. Please tune in and watch the Board of Health before the full Ways and Means Committee for our budget.
This is the first time in 10 years that I haven't been on the Ways and Means discussion.
We have subcommittee reports which we're going to hold until we get to that part of the agenda protocol for providing vaccinations to children in cooperation with Burlington Public Schools. We're going to hold that. The next is a series of discussions. The first is 2020-2021 flu vaccine purchase recommendation. As many of you know, my son is a vice president level executive with Sanofi, whom we buy our flu vaccine. So therefore, I need to recuse myself as part of a conflict of interest. So I'm going to turn this over to my two.
If you recuse yourself, we no longer have a quorum.
That's okay, it's just in discussion. We're not going to vote on anything, just a
Yeah.
discussion.
For informational
Purposes. So with that, while you discuss it with our staff, I'm going to be sitting in the other room. Please come and get me. Mary Beth.
Okay.
Thank you.
Can we discuss it with only two? Even though we're voting?
I think
Yeah,
you
it's,
can
it's
discuss it.
open meeting, it's posted, we can, yeah, we can talk.
Okay.
Okay.
So Chris, go-
Proceed.
So this year, I have prepared a flu vaccine purchase memo for what we're going to need for our EDS flu clinic for October 3rd this year, for our flu clinic. So if you look at the numbers, I put in some graphs to compare what we, for the last few years, Susan and I had come up with what these numbers are reflecting for the flu clinic, and then also what we see for in appointments for others at the Board of Health. So my recommendation would be to purchase, because of the cost that was incurred, and not much greater per dose, to order pre-filled syringes this year versus the multi-dose vials, because the multi-dose vials, you can only draw 10 doses out of the multi-dose vials, where you have 10 doses in the pre-filled syringes in one box. So it wasn't much more in pricing. And I did also put here that I wanted to order 200 of the Flu Zone multi-dose vials, only because we've had an overage in syringes left over. So there was about 240 syringes left over that we could utilize for the EDS flu clinic. So I wanted to order 200 doses of the multi-dose vial, and then 500 of the pre-filled syringes. And then, of course, we're getting our state supplied, what we got last year. They will be sending us again the same amount this year from the state for the children under 19.
So we are kind of seeing a trend of, and I think the past 2 years specifically, yeah, of the 6 month to 18 years population. So we're comfortable that the 200 is going to be able to, actually it's 700. The 700 will be able to accommodate that increase.
Based on what the numbers here, yes, I feel, but because we're also you add in and configured that we have 180 doses of just the pediatric that's provided by the state. That's another 180 on top of the 700 that we will be purchasing privately.
And I know I brought it up last year, I'm gonna bring it up this year. Why do you think we're not seeing the 19 to 29 population?
That's a
It's
really
because-
You
good
think they're
question.
getting
We've been
it at work?
trying, huh?
I think they're getting it at work or at school.
I mean, the 30 to 49 should be the same.
Yeah,
The-
yeah, you're right.
The
I
56
just-
first should be the same. So I'm just interested because it sure seems that, and totally anecdotal, that seem to have heard about a lot of young adults getting the flu or have been significantly ill. So I'm just, so I would just put out something for the community now, but we'll talk about it obviously later, that just because you're 19 to 29 does not mean you cannot succumb to the flu. And I would definitely encourage folks to think about the flu clinic. But I'd like to know, I mean, I don't know if we could do some kind of,
Stats from outside of Burlington?
yeah, some
Do
kind
you
of,
have
some
that,
kind of
Susan?
study, or
That's a good point.
if we get an intern on that, I'd love to know what, because that's significant compared to everybody else.
so right now, we do have some nursing interns.
Yes.
That may be something that Chris
I
could
don't
help
know.
them.
Yeah.
What could we?
But
what-
but the state provides a flu report. Is it in the state's
Is
flu
it
report?
similar to that, for that range? Like,
I don't know if that's in, if the
It's under,
state breaks it
well,
down
that
by
covers,
age.
yeah, it breaks it down by age.
do?
You're talking about MIIS? the
No, I'm
Home
talking
Immune
about the state's flu report
Oh,
that they
yeah.
put out
I
for the
can-
entire state. Is
weekly-
that what you're interested in, the
weekly
entire
flu-
state?
No,
Well, you-
frankly, I'm interested in Burlington.
Yeah.
So I'd like,
So this is the information that we have for Burlington.
well,
Is-
of who's not getting the flu, but I'd like to know why. Are these folks, as Mary Beth just said, are they getting it elsewhere? Or are they not
Just not
interested in
getting
getting
it,
it?
yeah.
If they're not interested in getting it, knowing that they are no less at risk than anyone else, what could we be doing as a Board of Health and as a model in our 4A territory, what could we be doing in
Educate them,
order
yeah.
to encourage it?
So that sounds like some kind of survey.
Yeah, that's what I was
Survey
thinking.
the population somehow, yeah.
Could we add that to, I mean, no, I'm thinking they don't probably join the health fair, but that age group.
Well, we have that age group as a problem attending
I
the health fair.
I know, I
So
thought
we've
about
been
that.
trying to find ways, the
Yep.
interns and myself, on how to attract those 19 to 30-year-olds.
I mean, you're doing a
just
good
to the
job.
health fair.
I'd like to do maybe, you know what might be interesting, is to talk to 18-year-olds at the high school and find out what their thoughts are about the flu, what their understanding is. I don't know, we can talk about this offline, but I think there's some things we could do, and maybe the high school could offer a repository of folks to talk to us via the medical special interest club that they have. So I don't know, we can talk about it. But I think it's,
There might
see
be
that.
some way to reach out to that group.
Social
Yeah,
media is a
well, we
great.
do
yeah.
social media now.
I think you're right, it sounds
But-
like a Survey Monkey, something
You
that
need
asks those,
to have
that
to,
certain population those specific
Love-
questions, but
love to know.
Are we able to do a survey monkey to
I
the
don't know
public?
if we can.
In Burlington
I
alone?
don't know, I don't think so.
We can talk about it
Something else,
offline,
but
but
it-
this is something I'm still interested in. Anyway, you know, I'm good with this.
so, just
We sure have enough experience.
Yeah, so we picked the 170 for the high dose because that's what we had last year, but we weren't able to test out last year whether or not that was enough because of the problems with the shipping and everything. So we just kind of stuck to that same number just to see how that goes with the 170 doses. And then if you, on the last page, you can see what the schedule is for how many doses we should receive. So this last column here, October, that's by the end of October. So
Our flu clinic's
for-
in early October.
Right, it's early October, so we'll have, that's why we ordered a little bit more of the multi-dose vials, just in case. Because as you can see, so the multi-dose vials will have 162 by the time the EDS rolls around. And, you know, roughly over 300 of the pre-filled. So these other doses, we may not get by the time the EDS comes around.
Okay.
But we also get 25% reimbursement, so we can be reimbursed.
Do you get a lot of walk-ins after the clinic, Chris?
You mean at the Board of Health?
Yeah.
Not walk-ins, but by appointments.
By appointments.
So we do pediatric
Thinking
appointments, we
walk-ins
do
are-
the high-dose
Yep.
clinics, we do the emergency responders, all at the Board of Health. So, and these numbers here on that last page don't reflect the
Reflect-
state
yep.
supplied, so they're just private.
Which is the order that you're putting in, okay.
I mean, I just want to tell the community that I think it's a great goal to not only attend the EDS drill that we have for flu clinic, but that everybody should focus on getting their flu vaccination before Thanksgiving. I think that's a fantastic goal. So it looks like we'll be able to accommodate that goal.
And we still have flu vaccine available now, so those that have not received their flu vaccine, it's not too late.
Not too late at all, not too late at all, absolutely, thank you. All right, so I know we're not voting, so I'm good with this. Yeah. Go ye forth. Oh, we're on TV. I'd like to welcome you back to the Board of Health.
Thank you very much. For those, I had to recuse myself. Okay.
We're going to order some vaccine for next year, for the flu. Very excited.
The second discussion this evening is the protocol for providing vaccinations to children in cooperation with Burlington Public Schools. We have a subcommittee report this evening, and we can, would you like to just review the subcommittee report very quickly, or?
Where's the subcommittee report? Actually, I have not seen the subcommittee report, because I am errant. Here it is, thank you. So, Mr. Chair, yes, last Wednesday, February 12th, you and I and our director and Assistant Superintendent Larkin and the Burlington Public School lead nurse, Ms. Connolly, all met. And the whole idea, the whole issue was brought up at a previous board meeting in which we had a discussion about minors who required vaccinations in order to attend school, but may not have parents able to, or guardians, able to accompany them. I was very concerned about making sure that we were protecting the children, protecting the school, and protecting ourselves in meeting the Board of Health in administering vaccinations. So I wanted a further discussion on how we could work, we, the Board of Health, could work in a collaborative way with the schools in order to make sure that, above all else, the children were protected in this. We reviewed policy, and ultimately, we all decided that a member of the school staff, if approved by a parent or a guardian's signature on specific paperwork that we have and the school now has, they could act as a temporary agent for the child, in which the temporary agent takes responsibility for the child and must be present during vaccination. So somebody from the school is identified as a temporary agent overseeing this aspect of a child's health care. So the temporary agent would also be responsible for signing the vaccine screening form on the day of vaccination. There were questions about transportation, which I think are beyond the purview of this discussion, but the school was in agreement that children would be accompanied at all times between the transition from the school to here, regardless of age. If more vaccinations are needed, the school is going to be responsible for ensuring that the child did get a physical examination, which is part of our protocol, before multiple vaccines are administered. And there was a discussion about the Board of Health and the schools working together for routine vaccine administration as part of the vaccinations at the school or regardless. It was just a discussion. So overall, it was a wonderful discussion. I felt that the schools were extremely attentive to our concerns. The director presented the Board of Health issues very nicely, and we all were able to agree that this was the appropriate way to go to make sure the kids were taken care of.
Thank you very much. We do not have to vote on that, correct?
You do, so to approve it.
So I believe that the subcommittee report was 2-0 in favor of this Board of Health policy on vaccinations for minor children without an accompanying parent or guardian.
Thank you. I'd like a motion to approve with just a change in the proposed verbiage that the last point was a discussion as reported by Dr. Saltzman.
Yes, I can change that in the minutes, and the approval will be for this protocol here. Yeah.
Yeah, so,
So first, a motion to approve the subcommittee minutes?
We're just approving the minutes, right?
You don't generally approve subcommittee minutes, just a report.
That's what I just asked, just the complete
Okay.
report.
subcommittee was
okay.
2-0 in favor.
Your approval will be for the protocol itself.
Correct.
Yeah.
So the protocol was reflected the report by the subcommittee, and I need then a motion to approve the protocol for providing vaccinations to children in cooperation with the Burlington Public Schools.
So this is already approved? I guess
No.
I'm.
No,
No, it's not.
we're approving it now.
We're doing
Approving
it right
it
now.
right this minute.
Okay, we're not going to review it all?
Well, it was reviewed
You
in
have
the
any
subcommittee.
questions?
Do you have any
I do.
questions?
If you have questions,
I
Marty,
do,
we can answer
okay,
them.
thank you
Yeah.
so
Well,
much,
we'll-
okay.
We have questions once you make the motion.
Thank you, okay.
Do you make a motion to approve? Or do you make a motion?
I'll make a motion to approve,
You second,
and then we can have discussion.
and then we'll discussion after it's second.
Or you can ask questions now. That's
Yeah.
fine.
'cause
Whatever you wanna do.
I do, I have
Okay,
questions.
all right, go ahead.
Thank you. So, thank you so much for putting this together. I just had a question in regards to the transportation, so that's approved?
No, it's not approved.
Okay, that's
We're
up for
talking
discussion.
about the approval of it now. The subcommittee worked out an agreement, a draft agreement with the Board of Health. And that's what we're bringing to you right now, is the proposal which the subcommittee has negotiated with the Burlington Public Schools.
But to answer your question specifically, the minor children will not be arriving to the Board of Health independently of their agent. They will be coming together, whether it be by we had just talked about either having a Lyft or an Uber, transfer the agent and the child from the school to the Board of Health and then back again, or evidently there is the possibility that school personnel with approval from parent or guardian can take kids from the school to here.
And if a parent wants to bring the child, the parent can also. This
Right.
is.
The
this-
parent, I understand, and what I'm looking for is, do we have counsel on that
So-
a staff member can transport a student?
This protocol doesn't include, what you would be approving tonight does
Yeah.
not include transportation.
Okay, that's what I
left
That's the
up to
school's
schools.
responsibility.
So
It's totally on the
this is
school.
only addressing
And that's not part of this?
our, involvement with it. We won't be transporting anyone.
Okay.
We're not involved. It's totally school's responsibility.
Ability.
Yeah.
Okay, and that's what I thought, that was part of, I read that, but maybe I'm reading it wrong, I just want to make sure
Yeah.
we have,
Yeah, it doesn't address transportation in these
Thank you.
5
In fact, if you
points.
look at the protocol, the draft that's presented, it
yep.
has absolutely
It's not in
no
here. Yep, I
transportation.
just
It was
read it.
just, and mea culpa, I should have said that the school is responsible for getting the kids here and back, and working with parents.
No.
Outside.
We need a second. A second. Any other discussion?
No, I want to thank the Assistant Superintendent Larkin and Head of Burlington School Nurse Connolly again for making that discussion very easy.
And I want to thank our Board of Health member, who also serves as our medical director. So I have a motion and a second. No other discussion. All in favor?
Aye.
Opposed? 3-0.
Great.
Now, the last discussion point this evening is a mistake that we had around our March 10th, 2020 meeting. We, in error, canceled that meeting because we thought that that was a holiday that warranted not having a meeting. We have clearly decided that that was in error, and I need a motion to reinstate the March 10th meeting.
So moved.
I have a motion. Do I have a second?
second.
I have a motion, second. Any discussion?
Is anybody going to be punished for this submission?
I guess that would be me.
Okay, so we will talk about punishment later.
All in favor?
Aye.
Aye. Great.
Great.
Staff reports. Environmental engineer.
Good evening. I just wanted to inform you that I participated last week with Marlene Johnson, our health agent, and Samantha Hardy, our assistant, what is her title?
Associate Health Inspector.
Associate Health Inspector, in the food code review. That was attended by approximately 80 people from different food service establishments in town.
8-0?
80.
Fantastic.
And my portion of that presentation was on chemicals in the workplace. And I just went over some basic chemistry and compatibility information, labeling. And understanding what the labels and safety data sheets, the information that they can convey, and the training requirements for those food establishments.
Awesome.
Yeah.
Are there any other questions for our environmental engineer? I do. As we have begun to discuss, Stericycle, who has done our household hazardous waste day, is no longer providing that service. And our environmental engineer was investigating other groups that would be able to do that and the pricing, because
Part of the household hazardous waste was Stericycle
The
doing.
chemical collection.
chemical collection.
All the chemicals.
Yeah.
So they were the guys at the end.
Yeah,
Okay.
the big
Okay.
That's
operation.
the big operation, the main operation. And you were going to, and I see that you have investigated a number of companies and pricing, which would be significantly different. And I bring that to the attention of everybody because our Ways and Means is going to see a very large increase in household hazardous waste. So if you're watching, that's the reason. So please update us.
So, under the statewide contract for the past several years, there were only 2 vendors providing this service. And Stericycle was one, and there was the second vendor. And as the chairman said, we've been using Stericycle for as long as I've been here and longer. And they typically had the lower bid under the statewide contract, and we had experience with them. So they were, and it worked well for us. However, they opted out of providing that service this year. And 2 new people opted in on the statewide contract. And we are going with one of those newer people because of the pricing. And the reasons that the explanations I were given for the increase in pricing is that under the statewide contract, the prices were held stagnant for about 4 to 5 years, even though their costs to ultimately dispose of the materials have been on the increase. And they had not been able to modify the statewide contract to increase those numbers. And in fact, the statewide contract got renewed in December for 6 more months, and at that opportunity, one of the contractors bumped their prices up by about 25% per car. And it's my understanding from the new companies that just jumped into the statewide contract that they will be doing the same come end of this fiscal year, June 30th. So that's why we're anticipating between a 20 and 30% increase in the actual cost to dispose of the household hazardous chemicals. And that's the largest line item in our household hazardous waste budget is the actual chemical waste disposal. We get grants to dispose of the bulbs, we get the batteries taken away for free, and we pay minimal amount for the propane and other cylinders to be recycled. So the increase in the overall disposal costs is what's driving that.
So this was an issue waiting to occur.
Yes.
Okay, if no other questions?
I can think of no one better to argue this point before Ways and Means than our chairman.
Thank you very much for your confidence. But you're welcome to join us this coming Friday and then March the 4th at 7:30.
I'm very sad to report that I'll be in California visiting my parents this Friday, so, no thanks.
Do I have a motion to approve?
So moved.
And
Second.
All in favor? Aye,
Aye.
3-0. That brings us to supervisory nurse.
Good evening.
Yes, please, would you
Just a
provide us
couple
a...
of past events that we had. We did the bladder cancer screening for the firefighters. We had total 33 firefighters this year that did the screenings. And because of that, there was brought up at the Massachusetts Public Health Nursing Association meeting. And so myself and Kathy Whitaker in Winchester will be doing a presentation on bladder cancer screenings to get it out to other public health nurses so
Excellent.
that they can start this program at their health
Excellent.
department. So we
Excellent.
created a PowerPoint presentation, and we'll be presenting that on March 13th at the next meeting. Other than that, we did some Stop the Bleed training. We had a critical staff dispensing tabletop exercise, which I'm sure Susan will talk about as far as emergency dispensing. And then upcoming events, we have the health fair, which is March 28th, Saturday, at the high school. And then we have the rabies clinic on March 14th, Saturday, at the DPW on Great Meadow Road.
Thank you very much. So
I
the-
cannot stress, I've had a lot of flu, confirmed flu the past few days. Probably close to 60 cases, 57 to be total right now.
So that's the elephant in the room. Where are we statewide? You just mentioned Burlington statewide and precautions.
Yes.
Or
Yes, and it's not too late to get that flu vaccine
and flu vaccine is still available.
at the health, yes.
So please, if you haven't had the flu vaccine, please come and make an appointment with the Board of Health. We have flu vaccine. There's an expectation of up to 30,000 or more people in the United States who will die of the seasonal flu. We don't want anybody in this community to be stricken by this in a very serious way. So please, if you haven't got your flu shot, get your flu shot.
Mr. Chairman, may I add a couple of points?
Please, because you're going to be speak next on the other elephant in the room on the coronavirus, the COVID-19.
So, for everyone out there, the Massachusetts Department of Public Health has a weekly update on the flu status in our state. It actually comes out every Friday. So it was just updated on the 21st. Anybody can access it. It's through mass.gov, but if you typed in influenza Massachusetts weekly, it would come up and it would take you right to the site. So as of February 21st, we had gone from a very high just to a high rating for influenza. More of the type B than the type A, but the very interesting thing is that the flu vaccination this year is 45% effective, which is actually very good, and all of the strains of influenza that have been identified thus far have been covered by the flu vaccination. So, when Dr. Weiner just said it's not too late to get your flu shot, as did our supervisory nurse, it's absolutely true. The flu shot is effective against the strains of flu this year. So that's actually really, really good news. Do you want me to, and as you know, there have been tens of millions of cases of influenza. Thousands of folks have sadly died. This past week, there have been less folks in the hospital, and actually less cases reported, but it's still significant. There's a graph that occurs from the Mass Department of Public Health to show where influenza is, and people think that right now we're kind of in the midpoint, that it may not peak any higher, but we'll see. Regardless, quarantining yourself if you have symptoms, if you have a fever, stay home. If you have other issues or concerns, call your doctor. And your doctor will advise you on whether or not you should come in and be further evaluated. And isolating your sneeze or your cough is crucial, please. And hand washing is, aside from the vaccination, the best way to reduce the spread. And that is influenza.
Thank you. Also, if you are following the coronavirus disease, you can go to the CDC website, as many of us did today. Everybody here has one of the reports on the coronavirus, sometimes called COVID-19. And I'm going to ask both the supervisory nurse and the medical director to comment on what we can do to help prevent the coronavirus.
I'll just give some statistics and maybe you can give the prevention strategy.
Sure.
So statistics as of last Friday, where there was one confirmed case in Massachusetts and 15 confirmed cases across the country. But for those, that was as of last Friday. But for those of you who have maybe been watching the news, the number of confirmed cases in the country has increased. I think I saw a report of 50, something like that across the country. The risk of COVID-19 in our state is still low. And actually, I heard the head of infectious disease from Mass General Hospital speaking on the radio, and he said the risk of influenza is hugely more. He used the word hugely more than the risk of COVID-19. That being said, the CDC did also say today that it's not when, but it's how this illness will continue and how it will affect people, and they're still looking into it, and they are currently making a vaccine. Regardless, as of right now, the risk of flu is hugely greater than the risk of COVID-19.
And some of the things that people can protect themselves and others also fall into what you would do if you were in contact with somebody with the flu. So there's currently no vaccine for the COVID-19, just so everybody knows. It's probably in process now, but we do not have a vaccine for it. Some of the things to protect yourself would be to avoid close contact with people, obviously, that are sick, and avoid touching your eyes, nose, and mouth. It's amazing how people don't realize in an hour's time how much you really touch your face. So just be a little bit more proactive and try not to touch those specific areas, because those are portal areas for infection. Again, stay at home when you are sick. Cover your cough or sneeze with a tissue, and that tissue needs to be thrown away immediately in a trash container. Make sure you clean and disinfect areas that you touch. People don't think about door handles, bathroom door handles, bathroom toilet, the thing that you flush with the toilet, things like that. When you're touching all the time, your phones, your area where you're eating, things like that. So just remember to just disinfect your area, workspace as well. And then follow the CDC's recommendations for using a face mask. You don't have to use a face mask for this COVID-19 right now. We don't have, they're not suggesting that anybody use a mask at this point. So they don't recommend that people wear a face mask, especially if they're not exposed to it or if somebody around them is not sick. You want to make sure you wash your hands really well. I always say wash singing happy birthday, which is about 20 seconds time with good soap and water. And if you're going to use the hand sanitizer, please make sure that you use a normal amount of that you would use on soap. Do it between your fingers, your inside your hands, outside your hands, and let it dry before you touch something. And basically, that's it. Pretty much good hand washing protects you about 60% to 80% from receiving or spreading infection.
Are there any questions or any comments? If not, I'm going to ask for a motion to approve the supervisory nurses report.
So moved.
Motion is second. All in favor?
Aye.
Aye, 3-0. And Director of Public Health.
Yes, so I completed and submitted the annual report for this year. I was able to come up with a lot of new and different things that we've done in the past year, and I don't realize, all of the different things we actually do until the end of the year comes and I have to do the annual report. So it's nice to be able to come up with new things and different things that we've done throughout the year. So that's one thing. I just wanted to highlight the Region 4AB MRC conference. So this is a conference that we're working on with all of the MRCs in Region 4AB, which includes Burlington, Brookline, Metro East MRC, Newton MRC, Norfolk County 8 MRC, and Region 4A MRC. So we're all getting together. I'm going to have this day-long conference on a Saturday. It's going to be in Waltham. So they're going to provide lunch to the volunteers who participate, and it'll be different sessions that they can go to throughout the day. It's going to include psychological first aid, CPR, probably pet first aid. Chris is going to do a presentation, the one that she did for our MRC, on vaccinating children. So there's going to be a variety of things there. So I think that's going to be a good event, and it's nice to be able to collaborate with the other MRCs.
Any questions?
Any questions?
Questions?
What's happening with our health fair?
Health fair is moving along really nicely. We are going to put out the advertisements. I think we sent out the PSA poster today. And we've got it filled up. We have 62 tables. And we have filled up for demonstrations, exercise demonstrations, and also, which is new this year, is the speakers. So we have a variety of speakers that are going to be speaking on different topics. And it's moving along nicely on schedule, so.
How much does it cost for the community to come and see 62 tables with the Burlington Health Fair?
It's free.
It's free.
It doesn't
And-
cost
and they give
anything.
away free
And we're
stuff.
also gonna have free raffles, and also this year, we're trying to add like a touch-a-truck type thing on the outside, so Burlington's gonna come with their incident command unit, hopefully. I think we've got it confirmed.
Yeah.
And the fire department's gonna come hopefully with their ambulance and a fire truck as well. So we're gonna try to stage those probably in the student parking lot, so when people park, they can go in and see the trucks and then come in to the health fair. And there'll be speakers every half an hour, exercise demonstrations, and the 62 tables. We're doing things like, there'll be posture screening, stress exercises, all different kinds of, 9-round is gonna be doing a boxing demonstration, and so there'll be, Matter of Balance, our BVRC volunteers are gonna do, Matter of Balance exercise demonstration. So we have lots of things planned.
So even if you have been at the health fair in the previous years, every year there's something new, there's something amazing. So absolutely no reason why the entire town should not show up at this thing, because it's fantastic, and the office does a lot of work to get this ready for the town. So please, please, please make an effort to come.
Any, I just have one comment. I'm asked this question all the time. In fiscal year 2019, we had 234 food establishments in this town. As you're probably aware, if you're looking at the Burlington Patch, you're looking at the newspaper, that number is going to grow again, be much higher next year. But at this point in time, for a community of 24,000 people, we have 234 food establishments in Burlington, which is just an amazing number, which means that Board of Health, in that group, in that division of the Board of Health, has to do hundreds and hundreds of inspections throughout the year.
One food establishment for every 100 Burlingtonians.
It's pretty much.
It's amazing. It's amazing what we have in this town. Mr. Chair, I make a motion to approve the Director of Public Health report.
Any second?
I have a motion second, all in favor?
Aye.
Which brings us to the end of our agenda. Does anybody else want to bring anything up?
I just want to make sure there's nobody for citizens' time.
Nobody is for citizens' time here. I can guarantee you, because there is nobody sitting out there this evening. With that, a motion to adjourn,
So moved.
and a second.
Second.
All in favor? Aye.
Stay
3-0.
healthy, everyone.
Good night.
Good night.